It's time for our Sky debate now. GPs should send patients who are at risk of developing type 2 diabetes to Weight Watchers. This is according to a new study that's been published in the British Medical Journal. Experts found that patients with so-called pre-diabetes, that's where their blood sugar levels are above the normal range but not high enough to be diagnosed as type 2 diabetic, could considerably reduce their risk of developing the condition by enrolling in a weight management programme. So we are asking this morning, should GPs refer patients to weight loss classes? Joining me to discuss this, we have specialist obesity dietitian Nicole Berberian and Dr. Jude Oben, who is at St Thomas's Hospital in central London for us. Good morning, both. Now, I'll start with a basic premise. I will come to you first, Nicole, if I can. Should GPs be taking into account weight management classes when trying to get a handle on patients who are either approaching type 2 diabetes or are facing obesity?
Number one, they need to look at weight management and exercise and whatever that patient needs to support them and to motivate them. The GP's job is, first of all, to identify who is at risk and then give them an appropriate referral. An appropriate referral includes, what does that patient want? So it's not necessarily a one-size-fits-all, everybody does the same program, because everybody's different. But certainly the GP is the starting point to find out, does this patient need some support and what's the best support for them?
And that's the starting point. I'll come to you, Dr. Jude Oben, if I may, because presumably by the time they get to you at St Thomas's, it's too late. You are a trustee of the Obesity Action Campaign. What can be stopped? What can be done to stop patients getting to you there at the hospital?
Actually, I think there is no issue here with this study, because essentially you have to first of all ask yourself the question, where does type 2 diabetes come from? What causes it? And the answer is simple. It's invariably caused by obesity. Therefore, the idea that patients who are pre-diabetic should get weight management classes, there is no question. There is no issue here. Again, come to my classes here or come to my list here. By the time you leave, you will be distressed. So there is no issue here. All patients who are pre-diabetic absolutely should get classes in weight management. No issue to discuss.
Nicole, it's interesting, isn't it? It's a lot of weight management classes, things like Weight Watchers, Slimmers World. A lot of people focus on the diet and changing the diet, but a lot of those classes will argue and go, hang on a second, we are so much more than that. We incorporate lifestyle changes. And you can put someone on a diet, but eventually they will fall off that at some point. It's changing their mindset.
So we can see it's everything. We need to do motivational interviewing to really go, what does this patient need? Where do they struggle? Is it a motivational factor? Is it a knowledge issue? We want to get them exercising. We want to keep them on track. So you could give them a one-hit class. That might get them so far, but you need to keep repetitively seeing them, supporting them. Support groups are available so that there's sort of friendships building up. Friendships can connect and support each other, maybe going for walks, doing cooking recipes together. It really is so much more than just one class together. But yes, all of it works together and it's not just one element.
Well, that sounds like the ideal. I mean, that must be music to your ears, Dr. Jude Oben. Diet plans, motivational speaking, support groups. But the NHS is so stretched. Can it afford to spend the resources and the time? We're talking about GPs who get 15 minutes per patient.
Yeah, it is indeed music to my ears, because one of the things that I always do when I see my patients is to ask them, why are you overeating? Because invariably there are issues that causes the patients to overeat. So the idea that the patient should get motivational interviewing, fantastic. The idea that they should get buddies to go for walks with, fantastic. The idea that they should get psychological support, fantastic. All of that in addition to dietetic therapy. Brilliant. All of the above, tick, tick, tick. No argument.
But Nicole, how does the cost stack up? Because we hear that the NHS spends £10 billion a year on patients suffering from obesity. And the thought is, by sending a patient to a weight loss class or a lifestyle changing class, if you want to look at it like that, will cost £150 per patient. So when you look at the economics of it, it makes sense, but it is the time factor for staff within the NHS to deal with this.
It is the time factor, but the structures are there. There is more and more initiatives there. We've got so many commercial organisations as well as NHS organisations. There's schemes with the local leisure centres where GPs can refer for vouchers. We have got so much there now.
Actually, you mentioned the word commercial there, and you've also talked about the psychology of overeating and weight problems. Is it different if a patient pays for something like this themselves? Is that more motivation because the money's coming directly out of their pocket, not just coming from the NHS system?
It can be. It can be. It depends where the individual is at. For some people, they decide, right, today's the day, I want to go right now and I want to pay somebody. And once they've paid that money, they're going to make sure that that's part of why they stick to it. But that's not the case for all. Somebody really might not have the means, and then they've got the services there. Actually, there's no excuse for all of us. And the individual can take responsibility right from the word go, even if there's a waiting list.
We'll get a last word from Dr. Jude Oben. We're running short of time, but if you were to give one of your motivational speeches to anyone going into their GP today that wants to get a handle on pre-diabetes or their weight problem, what would you say?
I would say that you need a holistic approach to the patient. So one, as I've already said, why is it that they're overeating? And not only that, you've got to tell them that they have to imagine obesity being in the middle. And type 2 diabetes is but one of the consequences of obesity. The one thing that we are absolutely scared of at the moment is cancer. There are patients who are young getting ovarian cancer from type 2 from obesity, getting colon cancer from obesity, esophageal cancer from obesity, liver cancer from obesity. So type 2 diabetes is only but one of the consequences of obesity. So fantastic that we're getting the chance to talk about this, but it isn't just about type 2 diabetes and exercise. It's about motivational interviewing and ensuring that the patient understands that type 2 diabetes is only a consequence of obesity. You got from all the other consequences from head to toe, including arthritis, which I haven't mentioned.
Okay, and that is your wake-up call this morning. Dr. Jude Oben and Nicole Berberian, thank you very much for coming to see us this morning.